All right, everybody, today we're going to talk about post-ACL management. Unfortunately, we are in ACL tear season. A lot of my field players, soccer, lacrosse, have been getting a lot of ACL tears. We'll do a video on things that you can do to prevent an ACL tear, but this video is about post-ACL management after your surgery, all right? So the first thing you want to do is you want to manage the pain and the swelling, all right? The pain is really to your tolerance. You can do whatever your doctor wants you to do on the pain management side. The swelling side, there are a couple of things that I like to do immediately. The first thing is rest, all right? And rest is important because the first 2 days of any type of injury, you want to allow the human body to go through the inflammation phase. The inflammation phase is important because it's the start of the healing phase. We don't want to retard the inflammation phase. We want to let it run its course. So give it about 2 days, allow the inflammation to be there, and let it run its course. Number 2, we want to do some compression, all right? Compression is really important. You want to compress the joint as much as possible. Your brace that you have will serve as good compression. If you want to continue to compress it a little bit more, get some tensor bandage and wrap it around the brace. Now, my strict kind of guidelines is that you don't want to compress for too long. I leave it on for maybe 3 to 5 minutes, and then I uncompress it, allow the fluid to come back in, and then compress it again to push the fluid back out. Number 3 is elevate. So you're gonna be laid out, most likely in extension. What I want you to do is lay down on your couch or lay down on the floor and get your hip at a 30-degree inclination, all right? So make sure that you are keeping a straight leg and elevating your leg so that the swelling can go into your lymph nodes. Your lymph nodes are right here in your groin, all right? The last thing that I actually want you to do is massage it. And massaging it meaning you're gonna have a cut right through your knee like so. I want you to massage the swelling up into your groin like this. And this will work very well while you are elevating your foot, right? So the swelling is already going on the downhill. You're just gonna help it a little bit more by squeegeeing that swelling into your lymph nodes, all right? Number 2, it's really important that you do this on a routine, all right? And you do it every single day. If you don't do it on a routine, you're like kind of on and off of it, you're literally just adding more days of rehab on the back end. The more consistent you can get, the more that you can drill this into your head at the beginning, the better the outcome on the back end. Number 3, early quad activation, all right? Early quad activation means I'm trying to get, this is my quad, I'm trying to activate that quad as much as possible. So think about getting the back of your knee to the floor as quickly and as hard as possible. At first, it's gonna feel so foreign to you. You're not gonna feel like your leg is your leg. But the first part of it is turning on this muscle. So as much as you can throughout the day, you're thinking, I'm turning on my quad, I'm turning on my quad, I'm turning on my quad. A great trick to do this is you can do it on both sides. Do it on both quads at the same time, which is closing your eyes and turning on both quads as hard as possible and then coming back down. This is what we call an isometric contraction. We isometrically are contracting our quads together, like this. All right, and I want you to do that throughout the day. Neuromuscular activation, that goes on to with what we just talked about, which is quad activation, but there are products out there that you can use, like a Compax. You can put it onto your quads and really just try to turn on your quads all the time. It's really turning on the nervous system to turn on to the quads. Number 5, mobilization. You need to mobilize your knee as much as possible, all right? In every direction, but especially in extension and flexion, all right? So extension is straightening out your knee, and flexion is flexing your knee like so. Getting into that mobilization as much as possible and moving it as much as possible is really important. The strongest your knee will ever be after the surgery is right after the surgery. So try to move it as quickly as possible. And number 3 is normal gait pattern. You want to get that normal gait pattern as quickly as possible. I know you're going to be on crutches, and they're going to tell you to not try to walk on it, but I want you to try to walk on it. You want to pattern a normal gait pattern as quickly as possible. From my experience, like 3, 4, 5 months, 6 months later, if you still have a limp, it's because you didn't start doing consistent normal gait pattern right at the beginning. So when you're on your crutches, you don't have to fully weight bear right away, but you can practice being in a normal gait pattern and mimicking your good leg as much as possible. Try not to baby it. I know it's painful. You have to do this within your pain tolerance, but this is something that you want to do as quickly as possible because you want to pattern a normal gait pattern as quickly as possible. All right, hopefully those 6 things helped. Please let me know if you have any questions. DM me. Obviously, make sure that you let your therapist know that these are the things that you're doing. Make sure you consult your doctor before you do these things. You can always get in contact with me on social media, which will be right here. And hopefully that helped. Move free, humans.